Snoring and sleep apnea result in restless nights, and those affected end up feeling tired all the time, but relief is possible. Joining me now is Dr. Stan Farrell, over there on the left, and of course his patient, Dr. James Coop. Now, you're a chiropractor, just so people know. Now, Dr. Farrell, people usually think when they have to get treated for snoring, they think they have to get surgery, and you say that's not always, not always necessary.
Yeah, that's not the case in many cases. The area where the snoring is taking place is usually at the back of the throat, where the little thing that flaps down the uvula hits, or it's the back of the tongue hitting the back of the throat. So sometimes if the surgery is done to remove the uvula or treat that area, it can be ineffective if in fact it's the back of the tongue.
And that's what we can see in that graphic right
there.
there.
Yeah, if we look at that there, what we're seeing is the top picture where the airway is open or patent, and air is able to get through without making noise. And then as it closes off, then it's going to make flapping and snoring noises and whatnot. And that's also the same problem that arises in what's called sleep apnea.
Now, you have a device that people could get that's an alternative to surgery or repositioning, correct?
Well, the repositioning of the lower jaw is what really stretches things open in the back and pulling the tongue forward. And that's the trick. So once somebody is accurately diagnosed, I mean, obviously people know if they're snoring. You know, your spouse is going to tell you, somebody on the other side of the house will tell you if you're snoring. Somebody's going to tell you if you're snoring, and then you have to decide, well, do I care? Do I really want to, for their benefit, do something about it? And if you do, if you're tired of sleeping in the other room, or something of that nature, if that's your consequence, having something that repositions your jaw and stops those things from happening can be the solution. It's an easy solution.
Can we, let's take a look at the device. We have a still of that. Now, this is something that just people sleep in.
Yeah, absolutely.
It's just that simple. They have to get size for it and everything?
Yeah, absolutely. And that's the key. You don't want to, you don't want to be quick to go on the internet and get something that you make yourself. This is a precision device, and you have to be measured, and it has to be tested to make sure it's going to work properly. So not only do you want to have a dentist do it, but you want to have a dentist who has adequate training in this, has either done a residency in this area, such as I have, or has had some program training and certification in dealing with snoring and sleep apnea.
Now, let me ask your patient, Dr. Coop, here. Now, Dr. Coop, what were your symptoms that you realized you had sleep apnea?
My wife told me I snored a lot.
You snored a lot. And you realized you needed to do something. So you had the CPAP machine before.
I did. I went and had a sleep study, and they told me that I had a couple options. I could wear the sleep mask, the CPAP, or I could have surgery where they cut out my throat. But sometimes that grows back, or you can have your jaw resected, but sometimes that doesn't even work. So I said, well, I'll just stick with the CPAP. But unfortunately, sometimes I roll over and would get the elbow to the ribs, and so I was looking for other possibilities, and when I met Dr. Farrell, this just sounded like the too good to be true. So.
And was it too good to be true, or did your wife notice a difference?
Right away. My wife was very happy, and I was very happy. No more whistling from dislodging the CPAP, rolling over. Was sleeping just as well as I was with the CPAP, and she was very happy about it.
I'm sure a lot of people would be very happy because the CPAP, not only, I mean, you got to wear that every night. It's quite a bit to take with you, especially if you're traveling. You got to get that checked through security. And this obviously is a relief for a lot of people who don't want all that machinery, isn't it, doctor?
Oh yeah, it's a huge convenience factor and comfort. I mean, strapping something to your head and not being able to move around, for a lot of people, that's very uncomfortable.
What's the difference between the appliance for snoring and sleep apnea? Is it the same
very
one?
Very little, yeah. You can, and I do use the same appliances for both, and it's just the amount of adjustment and the positioning that's different for that.
Now, there's something I said earlier. I guess I got them mixed up. When you have repositioning, this repositions. But what's the other R word that you use for what people have to go through when they get that done? Is that really invasive besides the surgery? I think that's something that you mentioned, that the options that you had.
You mean not the CPAP?
Not the CPAP. There were 3 options. You said surgery is an option besides this, and another thing that they adjust the jaw.
Well, one would be resecting the jaw.
Resecting.
Yeah.
Okay.
Which is surgery too.
Oh, it is?
Yeah, that's another type of surgery.
Major surgery.
That's where they cut the jaw, and instead of temporarily moving the jaw forward, they're permanently moving the jaw forward. And and some people are that bad their case of sleep apnea and how far back they are, that really surgery is not a bad idea. But for 95% of the population, something like this is more than adequate.
95% of the population would probably be helped by this.
As opposed to surgery.
Oh,
They
wow.
wouldn't need to have the surgery. Yeah.
Well, what should somebody look into before they even consider getting anything done? Is it a sleep study they have to do, or can you just analyze them from what they tell you in a journal?
There's criteria, as far as the sleepiness, the diameter of the neck, how big their tongue is, can you see the airway, things like that. Those are criteria for getting a sleep study. Then once you get the sleep study, that's verification of, is it just snoring or do you have sleep apnea, and then what level of sleep apnea do you have? And then you can kind of decide, is this a viable option, which for most people it is, or in very severe cases, you do have to look at the surgery, or CPAP may be the only option. But for, like I said, most people, this is a very good option, and the compliance is a lot easier for obvious reasons.
Well, the R word I like today is repositioning with the appliance, because I
Yes.
tell you, surgery sounds very, very serious. Thank you so much for sharing your story. Thank you so much for telling us about that, because I know a couple of people in my family who I travel with who could probably find that useful. And if you would like to get more information on what Dr. Farrell just discussed, you can find it at azsleep.net or aztmj.com. They have 2 websites there you can log on to, or you could call the number you see right there on your screen.